First trimester ultrasonography. What's the indication for first trimester ultrasonography? First, to confirm the presence of intrauterine sac and exclude ectopic pregnancy. Then, confirm cardiac activity and fetal viability. Third, is to estimate gestation age. And first trimester ultrasonography known to the dating time of dating of pregnancy, ideal time for dating during first trimester with high degree of accuracy. To diagnose and evaluate multiple pregnancy, to evaluate maternal pelvic mass or uterine abnormality, then to assess certain fetal anomalies such as anencephaly, to diagnose molar pregnancy. This is the ideal gestational sac, should be rounded, surrounded by hyperechoic tissue, not in the cavity, either in the anterior part of the endometrium or posterior part of the endometrium and near the fundus. This is not a true sac. This is a pseudo sac, just collection of blood inside the endometrium or hematometria. Splitting of the endometrium here occurred, and there is elongated, no hyperechoic wall, and not embedded inside the endometrium. This is a gestational sac with a yolk sac, and this is beginning of formation of fetal pool. And this is how to measure crown lump length between the longest area in the fetal pool. This is the early pregnancy, and this is in the last of the first trimester, crown lump length, the two farthest point in the fetal pool. When to say this non-viable pregnancy, early pregnancy? When mean sac diameter equal or greater than 25 millimeter without an embryo, or crown lump length equal or greater than 7 millimeter without cardiac activity. Last two option, when there's absence of embryo or with heartbeat at 2 or more weeks after ultrasound that show gestation sac without a yolk sac, or after 11 days after an ultrasound that showed gestation sac with positive yolk sac. This is a picture of the missed abortion. There is no pulsation in the fetal pool. Fetal number should be reported, and this is very important. Amnesty and chronicity should be documented for all multiple gestation human possible. This is very, very important to document this in first trimester, because diagnosis of this in second and third trimester is very difficult, and because the complication mostly occur in monochorionic twins rather than dichorionic twins. Monochorionic twins need special follow-up to detect twin-to-twin transfusion syndrome, which not needed in dichorionic twins. This is a picture of lambda sign or parrot beak sign, characteristic of dichorionic twins. There is placental tissue between the two membrane, two sac of the embryo. Here is a T sign and membrane inserted just in the placenta, like letter T, and this is characteristic of monochorionic twins, which need special follow-up and more hazardous or more liable to fetal complication. And so another picture showing T sign like this, and there is more obvious lambda sign or parrot beak sign, placental tissue bridge between the two membrane or between two sac. This is a picture of conjoint twins diagnosed easily in the first trimester rather than in second or third trimester. This picture of the ectopic pregnancy. The endometrium is empty, and this ectopic pregnancy in the tube. And this picture of disturbed ectopic pregnancy and this collection in Douglas pouch. This picture of the cervical pregnancy fundus is clear, and the sac in the cervix. This picture of the Caesarean scar pregnancy fundus also clear, cervix is clear, and the sac in the area of Caesarean scar. This picture is difficult to diagnose and need meticulous ultrasonography to diagnose it. Heterotopic pregnancy. There is two sac, one intrauterine and the other ectopic in the tube. Molar pregnancy. This is picture of snowstorm appearance and should be confirmed by serum beta HCG level. And this is another picture of molar pregnancy. This picture of the pregnancy on top of the IOD. The D is displaced in the cervical canal and the gestation sac in the fundus. The picture of the anencephaly should be put in mind to diagnose it early first trimester. Thanks a lot.